Hello, and how are you? My name is Winnie Barawa, and welcome to my class today, where we're going to focus on focusing resources on effective school health, commonly known as the FRESH model. And if you're new on this platform, this is Miss Winnie Barawa channel, or rather what we know as Medical Academy, where we focus on lectures, notes, classes, and expert interviews relating to healthcare. If this is your area of interest, kindly remember to subscribe and click on the notification button so that you can be notified when we post our next classroom. So if you've noticed, we've been focusing more on school health and we have handled several topics, including the introduction bit. We have looked at characteristics of a health promoting school. We've looked at the components of our school health programs, the team members and their roles. We've been keeping it all with us. Remember to share the videos, watch till the end, and thank you again. So in this class, I want to look at a model known as FRESH in full, known as the Focusing Resources on Effective School Health. So let's dwell in and see what it means. So for those who are new to the word, Fresh Model is actually a document that was developed in partnership by four organizations, and that is UNESCO, UNICEF, World Bank, and the World Health Organization, and other Education International to offer a strategic framework within which to develop effective health programs. Remember, school health is supposed to be a component of the school learning activities. But now we cannot develop school health activities or programs blindly. We need a guideline, we need a document that can give us a framework of how to develop this. So FRESH was that document that was developed by the UNESCO, UNICEF, World Bank, and the World Health Organizations and other Education International to create this strategic framework within which can help us develop an effective school health program. And if you look at this picture here, there's a referencing of the school community. And by school community, we mean any part that is a part of the community membership. So we have students, we have community members, we have the nurses here, health facilities. This is part of the school community. But now when you look at the FRESH model, it creates the foundation policy or the foundation framework that helps us to create a good school program. So in this framework, there's policies here, as you can see down here. We got safe water and sanitation, there's school health and nutrition services, and there's health education. So FRESH believes that more of the tomorrow's diseases can actually be prevented by fostering health in school. And so the main four tools that FRESH was using to achieve this, or rather has advised to use for us to achieve this, is having a good school health policy. That is number one. There's provision of safe water and sanitation. We have skill-based health education and school health and nutrition services. So according to FRESH, this is the main parts or main tools that can be used to achieve a good school health environment or to achieve effective school health programs. So one by one, let's see, what does school health policy entail? So a policy, just from our first class where we defined it, is that this is a document or a statement that guides the activities of an area or a school or any other program that you aim to use. So in this case, school health policy aims to actually promote school health, such as skill-based health education, provision of appropriate health services, safe and secure physical environment, a positive psychological environment, prevention of abuse, physical harassment, health promote inclusion, equity in the school environment. So what policies are or these guidelines do is they need to provide an environment that is safe enough for our children. And with the safety that we are looking at is a bit broad. So we provide safety all the way from health services, safe and secure environment, that is the learning physical environment. We're looking at positive psychological environment, prevention of abuse, prevention of physical harassment or bullying, and inclusion and equity in the school environment. So a policy should actually encompass all these parts, all the way from the skills that the school is teaching or impacting in the children, all the way to inclusion and equity in the school environment. And so policies are best developed at different levels. So based on the governmental structure in a country, we can have school policies at community level. We can have school policies at the local, at the international, and even at the national, sorry, and even at the international level. So school policies is not just one for all policy. It's a policy structure that covers the different levels of management or the different levels of implementation for the different school programs that schools could be running. And the other bit is the skill-based health education. And with skill-based health education, we believe that this approach is focusing more on development of the knowledge, on the attitude, the values, life skills that are supposed to help learners to have appropriate health-related decisions. So remember, as we're going to school, our children are not supposed to just learn generally, but we need to have targets of what are we expecting the child to acquire. So apart from the knowledge, there's attitude, the life skills, that all this together can positively help the child make health-related decisions or have informed health decisions. And with this, or with the health based with the school skill-based health education component in the fresh model, is that it explores certain areas that are meant to help with health education and positive psychosocial environment that can help them cope with different issues. And with these skills that are going to help the children cope with different issues includes issues such as HIV and AIDS, it includes injuries, includes violence, substance and drug abuse, all coming together from the impact of the knowledge, the attitudes, and the values that are learning through the school programs. And so lastly, we are being told that with an effective school-based health education, learners are more likely to adopt and sustain a healthy lifestyle during schooling and even for the rest of their lives. Remember, what you teach a child in school is what they can easily propagate forever and learn all the way to the last day of their life, because that's what they practice, that's what they replicate, and that's what they take home from the classroom. And the third component is the school-based health and nutrition services. So with the school-based health and nutrition services, is this one looks more on how effectively schools can actually provide healthy and nutritional services, ensuring that these services are simple, safe, and so they should address the problems that are actually prevalent and recognized within the community. So with the health and social services, we are looking at taking care of the children and preventing problems that are common or well known in the community, and ensuring that our children are safe and they're able to be protected from any nutritional risks. So for example, how can we ensure that children are kept safe and are taken care of nutritionally while in school? So we have different approaches, and part of this is dealing with micronutrient deficiencies. This is underweight cases like kwashiorkors, marasmus, rickets, and so on and so like. We have cases of also worm infestations, and with worm infestations such as ringworms, most of the time children are taken through deworming and are given several or annual checkups by the schools. Then we have balancing meal times, ensuring that the food being given to the children is inclusive of the food diversity and has all the necessary nutrients that can keep them healthy. Other schools can opt for health checkups and treatment of minor health problems that the children could be facing at one time or another. And with this component, the target of this fresh model was to actually ensure the children have balanced diet, they are healthy, and they can focus in school. It's being known that poor health or poor nutritional aspects for our children tends to delay their cognitive development, and so they're not able to concentrate or perform well in their academics or their performance indexes. And for this, it's key and important that schools provide the school-based health and social services for the purpose of proper development and for the purpose of good performance academically for the children. And the last component of FRESH is provision of safe water and sanitation. So for the healthy school environment, hygiene education is becoming key, and this is to emphasize through access of clean water and adequate sanitation facilities. Now, sanitation is very broad, but also it looks at aspects that are very key, and here we are focusing more on water supply. And with the water supply, this prevents the children from communicable illnesses that could be propagated by water, such as waterborne illnesses like diarrheal diseases. It can also prevent us from malarial cases or some that are propagated by poor hygiene and sanitation and sanitary environment in our schools. So provision of safe water and sanitation means we are protecting the children from getting environmentally related illnesses or diseases that can actually slow down the class performance or performance of the children in the classes. And so with this in mind, this actually formulates the 4 areas that are very key in the FRESH model in ensuring that there is effective school health programs in the countries. So to sum up, having seen the 4 components of the model, there are certain challenges that, however, you need to recognize that can actually contribute to low performance in school. We've seen that the 4 components in the FRESH are actually the ones that can propagate or ensure that there is effective learning for the children. But you also need to appreciate that there can also be challenges that can contribute further. And part of this could include behavioral disorders, substance abuse, learning disorders, physical factors, factors that include emotional disorders, chronic hunger and malnutrition, lack of study skills or poor study skills, and chronic illnesses. So apart from the 4 areas that looks at nutrition, skill-based health education, looking at water and sanitation and so on, we also have other challenges that we need to look into apart from just the 4 areas of the FRESH. And with this, many other challenges that can lead to low performance, you need to check it all around, from disorders that span from behavior, learning, emotional, and so on. You need also to check on their study skills. Are they able to study well and comprehend what they are learning? Are there any known chronic illnesses that are running through the family or individual, and this is lowering the abilities of the child to focus and learn? Thank you so much for being with me to the end. Remember to comment, subscribe, and share these videos with your fellow learners. And if this is your area of interest, again, thank you so much for staying with me till the end. See you in our next class. Bye bye.